Greetings, I'm Dr. Wendy Island with Solutions Chiropractic. There's a few things that I think that everybody should understand about their bodies. This is usually the way I explain things in a patient's first visit, and I kind of thought it might be nice for everybody to have an opportunity to get a little insight into why things feel the way that they do. Your brain, obviously, is the master computer for your body. It tells the body what to do by sending electrical impulses through your spinal cord and your nerves. Your bones are put together really beautifully like puzzle pieces. They wrap around the spinal cord to protect it. And when they're seated properly, there's space between those bones for the nerves to come out and go wherever they need to go. If something shifts out of place, it pinches the nerve and you can get pain or dysfunction in the distribution of the nerve. So similar to hitting your funny bone can shoot to your hand, if you have something pinching in this low back, you can see how that might shoot all the way down your legs into your feet. If you have something going on at the base of your neck where everybody's working on computers from home, that can actually cause your arms and your hands to fall asleep. And if you get something at the tippy top here, that can shoot up over the top of your head and give you some headaches. Perhaps it can give you pain in your jaw, behind your eyes, into your sinuses. There's two nervous systems in the body. This one is fight or flight. You can see how the nerves would give the energy to the muscles. And this one is rest and digest. So many times my migraine patients might report that they might throw up with their headaches, that they get upset stomachs, they get heart palpitations, or they feel short of breath. And a lot of times that can be attributed to cranial nerve number 10. He's my favorite one. He's named vagus because he comes out right at the top and goes right down to the lungs and the heart and all through your digestive organs. Incidentally, kiddos with colic seem to get a significant amount of relief from doing a very gentle adjustment on that C1 to help relieve that pressure on the vagus and allows them to digest their food better. This makes them more comfortable. Moving on, there's 4 curves in your spine: cervical, thoracic, lumbar, and sacral curves. Those curves absorb shock. If you didn't have curves, it'd be like walking around on straight knees, and you can see how that would be a problem. However, when we're sitting in a chair that may not have great lumbar support and it flattens the low back, or perhaps you're looking down at your laptop or your phone, if you don't have those curves supported, you're going to have more issues going on in the low back. So many times we'll talk about things like posture and how important it is to have the lumbar support in your car, or if you're working on a laptop, raising that laptop up and getting an external keyboard so that you have more of a neutral position for your spine to be supported. Those things can be very helpful. Every one of these levels goes to different spots. And so this one just depicts why it might be if you're sleeping at night, your pinky and ring finger might go to sleep. It's because it's at these specific levels that come out in different places. So I like to pay attention to what level was the impingement spot, resulting in the numbness in specific areas in your hands. There's many muscles in the body. I like to take a minute, work on the muscles, because for example, with those hands falling asleep again, if these external rotators on the shoulder, because you're working on a computer, are pinching these nerves, that can also be a contributing factor to the arms and the hands falling asleep. So here's a short intro to what might be going on with your body. If we can be of help in any way, please let us know. Have a great day.